My name is Shea Damonze. I'm from Cape Town, South Africa. I'm also a recognized and approved addiction and trauma professional. I'm also the managing director of Integrate Evolve, which is an outpatient treatment facility where our primary focus is on addiction, trauma, PTSD, depression, anxiety, and various other mental health aspects. Addiction, to really put it in a simple way, addiction is a self-destructive behavior where people go out and seek short-term pleasure or relief, resulting in long-term consequences. Addiction is also an inability to stop these behaviors or the inability to stop using a certain substance. So even though someone might be caught up in the addiction and they really want to stop, part of addiction just creates that inability where they are not able to stop using drugs or acting out on certain behaviors on their own. So once again, it's a form of wanting to escape, numb oneself, looking for temporary pleasure or a stress reliever. However, the consequences that come with it are long-term. Addiction is also what we consider to be a chronic illness, progressive and terminal. So addiction is something that cannot be cured, but can be treated and managed. Well, if you're looking at the types of addiction, it really varies. If we really break it down into two parts, right? We've got chemical dependency. So chemicals would be anything that falls under the class of drugs in terms of alcohol, crack, heroin, cocaine, cannabis, what we call Bhang, mirungi, any substances. If we're looking at prescription drugs as well, painkillers, sleeping pills, those all fall part of chemical drugs in terms of the class, right? We're looking at process addictions, we're looking at gambling, sex addiction, eating disorders, social media, gaming, shopping addiction. There's a list that goes on. But if we look at the two main types of addiction, we're looking at behavioral addiction and chemical addiction. When we're looking at addiction, right, so even though certain addictions may vary in terms of the chemical or the actual process addiction, there's always a common theme and a thread. And like I mentioned previously, we're looking at a common thread of addiction. There's unmanageability, there's a loss of control, there's the progression of the illness. So we start out at one point where the user or the person acting out on a certain behavior might be in control of what they're doing. But as the addiction progresses, people lose the control. That is one of the common threads. If we look at all types of addiction, they're all kind of interlinked. So whether it's someone abusing alcohol or heroin or Bhangi or whatever chemical drug, right? If we look at someone who's hooked on social media, pornography, there's a fixation around the ritual, around what they're doing. So if we're looking at behavior being twofold in terms of the obsession and the compulsion, there's an obsession around either using a substance or engaging in a certain behavior, and a compulsion where people find themselves compelled to act out on this, compelled to either use a substance or to act out on a certain behavior. The most common addiction in Tanzania, I would say alcohol is probably one of the biggest. Alcohol and weed, just based on my experience, working with patients here and clients over the last period. I think in Tanzania, it's kind of been downplayed in terms of alcohol and the use of cannabis, because if you think of alcohol, most people tend to see it as being sociably accepted, you know, going out to a restaurant and having a drink. You won't find someone in a restaurant shooting up heroin or smoking crack at the table. So I think just in terms of that, I think there's a lot of people who tend to abuse those substances. But being in the country and working with the clients, like I've mentioned, and doing research in the field of addiction, just in the country, yeah, I think one of the biggest problems that we do face here is the fact that people are hooked on to prescription medication. When we're looking at opiates, pain medication, sleeping pills, benzodiazepines, there's a huge problem around that. So if I had to put it down to a list of the top 3 or 4 substances which are currently being abused in the country, I would say it's alcohol, cannabis, heroin, prescription drugs. And in terms of process addiction, I think throughout Tanzania, social media is probably one of our biggest challenges that people face. Gambling, I know, is on the rise in the country as well. There's a big problem with that. And a lot of people do not like to discuss this, but sex addiction, you know, it's very taboo. People don't like to talk about it, but it's a big problem globally. But in Tanzania, yeah, it's a problem in terms of process addictions. I've mentioned all the chemical addiction, but in terms of the process addictions, gambling, internet, social media, and sex addiction, it's on the rise. I think it's generally people's perception around addiction or an addict or someone that is addicted to a certain substance or behavior. So, you know, when there's a lack of understanding and a lack of education and awareness, people tend to either judge or create their own assumptions. So for a lot of people, when we're talking about an alcoholic, immediately people hear the word alcoholic and they associate it with someone sleeping on the streets with a bottle in a brown paper bag, sleeping on a park bench. And with me having done this work for a good number of years, 13 years, working in South Africa, across Europe, and now in Tanzania, you know, when it comes down to the stigma, I think there's a global stigma that comes with addiction. A lot of addicts are seen as being kind of outcasts, not part of society. Just generally people have a judgment or an opinion where there's a lack of understanding around what addiction really is. So again, there's a huge stigma in this country, and this is what we as Evolve is trying to really break through. Because with the stigma, it also prevents people from going out and seeking help, right? So if you're looking at the stigma that comes from communities, family members, society as a whole, and you look at the individual being the addict, there's a lot of shame that comes with being an addict. So reaching out for help is something which is really difficult for someone who's addicted who has a problem, even someone with a mental health issue. You know, there's a lot of stigma, there's a lot of judgment that goes around people, let's say with schizophrenia or depression or whatever, bipolar. People get labeled and people get teased and mocked and bullied as a result of having this illness. So again, this prevents people from actually reaching out just based on that shame. So the stigma really prevents people from seeking help, reaching out and actually going out there and saying, I've got a problem. So it's kind of like the pink elephant in the room. We all know that there's a problem, but everyone's talking around it. We don't want to admit that this is an issue. I'm in recovery for multiple addictions. My drug of choice has been heroin. I am in recovery, well, this year I celebrated 14 years in recovery, but my addiction basically went between chemicals and process addictions. Gambling was also one of my biggest addictions and my biggest problems in terms of just seeking something outside of myself to make myself feel okay on the inside. So for me as an addict, I would use anything externally, whether it was drugs, women, gambling, food, anything externally to make me feel okay on the inside. But as a result of using those things for short-term pleasure or short-term high, there were long-term consequences that came with that.